secrets. Today I'm going to show you 2 effective tongue stretching exercises. I know what you're thinking, who's ever heard of tongue stretching? Well, I'll tell you who, a speech therapist, like me. In all realness, these stretching exercises address the tongue's flexibility and range of motion, both of which are important for speaking and swallowing. Stretching is also known to release muscular tension, stretch length, and relaxation. So these techniques may also benefit someone who has jaw or mouth tension or vocal tension because of where the tongue muscles connect. There's also a study that showed that regular tongue stretching exercise can actually lengthen a tongue between 20 millimeters up to 40 millimeters, although in this study they did the tongue stretching exercise 30 times a day, which seems like a lot. Let's get started. The tongue is slippery, so when I do this stretching on myself or someone else, I use gauze, or you can also use a washcloth or cloth tape around your fingers to have a better grip. I'll demonstrate the technique first without the gauze so it's easier to see where my fingers are going. First, grab your tongue from the top and the bottom. Don't grab too close to the tip because if you do, your grip might slip and it can feel a little uncomfortable. Instead, hold the tongue a little further back. Once you've got a hold of your tongue, just let your tongue relax. We're not very used to the sensation of having our tongue stretched or even touched. So we want our body to be relaxed and allowing us to stretch, not fighting us as we're gently pulling it. So now with your tongue hopefully relaxed, gently pull away from your body. And you can even add a little side to side motion to explore if there's areas that are more tight than others. And the goal here is to gently stretch but not strain. There shouldn't be any pain, and how long you hold the stretch is really up to you. And here's doing it with the gauze. Really want to make sure you wrap the gauze around the top and the bottom of your tongue to get the full grip. And then once you've got your grip, pull away from your body. Pull until you feel a stretch that's comfortable, and I like to hold it there for a little while. Moving it from side to side. For me, I've got some TMJ on my right, so it feels really good when I stretch over to my left side. Before we get to the second exercise, please hit the like and subscribe button so I can keep making speech therapy educational content for people at home. The next stretch focuses on lifting the tongue and addressing the muscles that attach all the way down to your hyoid bone. Reach in and under your tongue with your thumbs. Put your pointer finger over the top to create a V. Now elevate the back of your tongue with your thumbs and use your pointer fingers only to help stabilize the tongue. The pointer fingers are almost rolling down while your thumbs push upwards. While in the first stretch we're gently pulling away from the body, this stretch should be upwards towards the roof of your mouth or the top of your head and should create a very different sensation towards your throat and your hyoid bone. You can do this on one side at a time and then move to the other side. Check to see if there's differences in the restrictions from each side of your tongue. With both stretches, stay towards the edge of your tongue, not so much in the middle. The lingual frenulum, the piece of skin that connects your tongue to the floor of your mouth, is delicate. The pulling on your frenulum can be uncomfortable. I hope you found this video useful, and as always, be kind to yourself.